Yes.
Okay.
Yes.
So, hi everyone. Thanks for joining our today's session. Today's session is specially for the IBS patient, and we have amazing two speakers here. The Dr. Abhay Chopada, who is a renowned gastroenterologist from UK, and Dr. Rashmi Kulkarni. She is a gut health expert. So, here to you, both of you, that you can start the session.
Well, thank you. Thank you for connecting with you again. So, Rashmi, I still am very, very intrigued after our last conversation. But today I want to be very specific about irritable bowel. And as a gastroenterologist and a GI surgeon, I can tell you that it's an extremely common problem.
Yes.
Not only is it common, but we struggle. Usually, if someone starts complaining of any abdominal discomfort, we end up doing so many investigations because IBS is a diagnosis of exclusion.
Yes.
We have Rome criteria for diagnosis, we have certain other tests. But let me put it this way, they're not that easy. Some people have diarrhea, some people have constipation, some people have bloatedness and pain. But the prevalence of irritable bowel is really, really very high.
Yes.
I've been looking at after patients with IBS for almost the last 30 years now. And the one thing that really struck me is most of these are busy people and most of them have an irregular lifestyle. Now, after what you explained to me last time, I want to hear from you as to how do you, as a gut health specialist, especially from a microbiome perspective, see irritable bowel? What do you think is really happening here?
Yes. So, hello everyone, and welcome to this IBS and digestive disorder specific session. So, as Abhay said, we have discussed this many times before. We see a lot of IBS, support groups on Facebook, on other social media, where people are just trying to help each other manage the symptoms. Because, as you rightly said, not enough is known about what IBS is, why people have IBS, and many of the things, it's still a mystery. So we have spoken about it. But in our experience, from all of the research that we have seen so far for digestive disorders in the field of gut health, the gut microbiome to be more specific, there are a lot of answers in terms of what is causing IBS. We already know a lot about it. There are changes in gut health. So, for example, if you say that people with who are suffering from IBS either have constipation or diarrhea or bloating or what all of these symptoms of gastric distress or digestive symptoms. So what is happening here is they are not able to digest the food that they're eating. And most people do not know for digestion of our food, we don't just need our own digestive system. We need the help of invisible microbes or invisible that which is our invisible organ. Now I'll go through the slides in a moment as to what exactly it is. But when we do not have good gut health, when we do not have that good collection of these microbes that help us digest our food, then digestion is not complete. That is giving rise to a lot of these symptoms. And people think these are just simple symptoms. What is wrong with constipation? What is wrong with bloating? But your body is not getting the nutrients that it should get. Instead, it is getting toxic products, which is very
Rashmi, I just wanted to kind of say that I explain to my patients slightly differently.
okay.
I tell them that basically, you remember, we think we have a nervous system which is helping us think.
Yes.
But there's a second nervous system which controls the body,
Yes.
and that affects the first one, and that is in the gut.
Yes.
And
Absolutely.
like you feel stressed in the body, your body can be stressed from what is happening inside the gut. So it's almost like whatever you put in is going to affect the way your gut is behaving. And if
Yes.
you stress it out, it's going to misbehave. And that misbehavior is either as a diarrhea or constipation or pain, because the gut only understands spasm or stretch. Now, once you lose the coordination, you start noticing pain,
Yes.
right? So I completely get your point that actually it is to do with the microbiome. But is it not also true that these microbiomes generate a lot of chemicals which directly go and affect your nervous system?
Yes. So when I say the gut microbiome, they are not just playing a huge role in digestion of food. But because they digest our food, they are also producing a lot of metabolites that react with our immune system, with our nervous system. 70% of our immune system is in the gut, which is around the digestive tract. So that's how they influence our immunity. Similarly, as you rightly said, the chemicals that our gut microbiome makes in the gut, in the digestive tract, are impacting our thoughts, our feelings, emotions, whatever, through our nervous system, because 90% of our peripheral nervous system is also in our gut. So as you rightly said, whatever you are telling patients, so a lot of people say that, oh, IBS is in your head. They are saying it because it is directly impacting the nervous system, which is actually in the gut. That is the huge role that gut health or the gut microbiome plays in emotions, in the nervous system, in IBS symptoms, and all of these. So very rightly, whatever you are told your patients is absolutely right. This is the gut-brain axis that we are talking about.
And before you go to your slides, one more question is traditionally we've associated stress
Yes,
with IBS. Is it the other way around? Is it the fact that you actually have a deranged microbiome making you feel stressed? Is it likely?
it works both ways. For some people, for some of the people who are suffering from IBS, it actually comes from the stress in their life. Stress itself reduces the diversity of the microbiome. It changes the microbiome, or it changes gut health. It changes the ability of people to digest food and subsequently the feelings that we just talked about. So it is both ways. Stress also affects the microbiome. If the microbiome changes because of other factors like diet, like other environmental factors, that also lead to stress. So what you have said is right, but the other thing is also equally important, that the microbiome impacts how stressed people are, and stress impacts the quality of the microbiome. So it's a vicious circle that we are talking.
Microbiome is a complex word. Can you actually just make it really simple for people to understand what you're talking about?
Okay, so I'll just go to my slides if it
Yeah.
is okay right now, to introduce briefly what exactly we mean by the microbiome. Let me just share those slides. So when we are talking about gut health, one thing that we have to understand here is that uh, it's like having a very beautiful house and not maintaining it. So this is what happens when we talk about gut health. I'm just going to start with this. This is something that I really like to show, that it's like a very beautiful house, but because we have not kept it in the right way, we have not maintained it, it is in a state of disarray. There are insects, there are roaches, there's mold growing everywhere, and this is what is happening in everybody's gut. I'm sorry for the disgusting image, but actually, because we don't pay attention to our gut health, now I'll come to that in a minute, what exactly is happening. That's the reason why we see majority of the chronic diseases, including IBS. So whatever we see here. So now we have to clean it up, right? We have to clean up whatever is happening in the gut. We all, who doesn't like a good, clean, good looking house that is very well maintained? So if we want to focus on cleaning this in the gut, we have to bring in the exact cleaner. So who are the cleaners? We are talking about the microbiome, which is our superhero. We call it our superhero at Arnagen Next. So what exactly is that? When we are talking about our body, we are just thinking about it as, visible organs. It's like, you take different parts, assemble them, and that's what makes the human body. This is the idea that most people have. Instead of that, if we go back, traditionally what the human body was associated with is not just the entire body, but our mind and the environment around it. This is what makes us human. This is what the ancient practices thought about. But if we really go back, not just to the ancient practices, but to current modern literature, we are a combination of not just our own visible organs, the environment, but also trillions of microbes, invisible microbes like bacteria, viruses, fungi, protozoa, archaea. All of these invisible microbes form something called our invisible organ. They are present inside and on our bodies. The number of these microbes are more than our own cells. They are trillions in number, and they're there for a reason. So we might think that, oh, we are trying to get rid of microbes all the time with all the hand sanitizers, hand soaps, and whatever. So what most people don't know is that these trillions of different types of microbes are actually forming our invisible organ. And why are they there? Why should we care about them? Because they are as important as all of our other organs. They do many different things in our body. We don't even know all of the things that they do. We know some of the things. So this is a component that is completely in our control. We cannot change our organs, but we can change our microbiome. It is a variable component. So if we really think about it, we are not 100% human. We are also microbial. So this collection of microbes or germs, as we know them, is called the human microbiome. Why should we know about it? Because just like we have microbes on our skin, in our mouth, in lungs, and everywhere, they form the skin microbiome, the oral microbiome. Similarly, we have something called a gut microbiome. This is the largest collection of germs that we have. It's 1.5 to 2 kilograms of microbes in our digestive tract. It is that important and that's significant, the number of cells that we have. And what do they do? These are just some examples of things. Now, this is just the tip of the iceberg. They help us with mental health. I will come to that also, how they help. They help us in absorption of minerals. Now, how important this is, you might know that many people suffer from so many different deficiencies, calcium, magnesium, iron. So they help us absorbing these minerals. When people have deficiencies, when they take supplements, what they do not know is that if they don't have the right kind of microbes to help them absorb these minerals, they are not going to solve the mineral deficiency. They will have to keep taking the supplements and they will have other side effects because minerals are not going where they should. Similarly, these microbes help us in making a lot of vitamins, like many of the B vitamins, majority of the vitamin K. Now, again, going back to deficiencies, people just take supplements all the time without thinking that, this is the microbiome is actually making these vitamins. So supplements are not going to help in that way. They also help us in digesting the food. Now, we talked about digestion. When people have symptoms like bloating, constipation, or whatever, the IBS specific symptoms, it's because there's not proper digestion that is happening, or there are other metabolites that are reacting with our gut. That's why people have diarrhea. There are pathogens in the gut, that is disease causing germs instead of these good beneficial microbes. So majority of the fiber that we eat, we cannot digest any of the fiber. The digestion happens only because of these microbes. They are the ones that digest fiber. So anybody who has any kind of digestive disorders are very likely not having favorable microbes in their gut. They might even have pathogens in their gut. It is very important to know that status.
Yeah. Is it then the right to understand that your microbes actually are good bacteria and bad bacteria?
Yes,
And
yes,
that's the
absolutely.
balance between the two that is really
Yes,
important.
yes.
Why do bad bacteria even exist inside our body? What is their role?
There are two different things. There are good bacteria which can be very high in number, and because there can be something like too much of a good thing. So too much of any probiotic strains, beneficial strains, if they are very high in number, even that is problematic. When we have a poor lifestyle, when we eat foods that are not clean, when we eat street food, or when we do not have good enough hygiene, what happens is we can get pathogens also in our body. And many people do not have symptoms that are severe enough. So they might not realize that they have these infections in the gut. That's why people have bad bacteria or bad germs in their gut without them realizing, because majority of the simple pathology tests do not detect these germs, because we need to know what to look for exactly. So they miss out on detecting these pathogens. So this is a problem.
Coming back to IBS, simply
Yes,
because I want to really focus on
yes, yes,
IBS,
yes,
a lot of our patients complain of sensitivity to specific foods. The symptoms are triggered by specific foods.
yes,
But when you do an allergy testing, you really don't find much of an allergy.
yes.
And we know that gut immunity is very different than the rest of your immunity. So how does microbiomes explain their sensitivity to specific foods?
Yes, absolutely. So the sensitivity here comes from, again, now I said that they are responsible for digestion of food, for making vitamins, for mineral absorption. So if we do not have the microbes that should be helping us digest particular foods, for example, people who are lactose sensitive, so we do not produce the enzyme lactase. At the age of 5, we stop producing lactase. So only children can digest milk properly. After the age of 5, we cannot actually digest milk on our own because we do not have the enzyme. Our body does not make it. But who makes that enzyme? It is these microbes that make the enzyme lactase. So people who do not have the microbes that are making the lactase enzyme become sensitive to lactose. Similarly, people develop gluten intolerance when they do not have the right kind of microbes to help them digest that particular food. So these food intolerances actually come from the lack of those particular microbes in their gut microbiome. It is very
Can
easy
I,
to find out
can I
whether,
ask an interesting
yes,
question, Rashmi? I'm
yes,
sorry, I'm interrupting you because I want
yeah,
to
no
think.
problem.
Then are you trying to suggest that some people who are intolerant to certain foods can reverse their intolerance through
Yes,
microbiome manipulation?
yes, we have done that. We have seen it many times in many of our patients where they had IBS or they had some kind of food insensitivities, intolerances. They did microbiome testing. They figured out that these are the microbes that are missing in their gut. They were able to repopulate those particular microbes because they knew exactly what was missing. And now they are able to eat the foods that they were previously not able to tolerate. We see that very commonly. It happens. It is easy to do. It is an easy fix.
And how do you really go about? Let's assume I've got a lot of gut issues.
Yes.
One thing we notice, and I can tell you from my experience, there are a lot of our patients actually who have IBS
Yes.
also have an element of depression.
Yes.
They have something that, they just say, this is completely overtaking my life.
Yes.
Now, the classic thing we used to do, and we still follow, is actually I would do all the basic tests. I will make sure the CRP is normal. Now, these days, we do fecal calprotectin to make sure there's no inflammation. But there is a small group of people who have very mild inflammation. We label them as inflammatory bowel disease, but they just don't behave like IBD. Now,
Okay.
I just needed your input as to whether we should really start rethinking about how we label IBS and how do we go about examining these people? How do we
O-
actually come to a diagnosis?
Okay, so I'm going to make a small diversion to talk about the mental health issue to, to come to this point. So just, I'm just going to share some more slides where I want to talk about a slightly different issue, which might sound unrelated, but I'll come to that, how it's extremely related to what we are saying. Now, if you see this image, it might look weird that it's not an AI generated image. This mouse is actually on this cat's head. So what is weird about this is the mouse will never go near a cat because it will be killed. The cat is going to eat it. The reason why I'm showing this is this mouse has an infection. It's infected with Toxoplasma gondii. This is a microbe that, you know what it does? This one type of microbe changes the behavior of of the mouse that it has infected, and it makes it attracted to cat urine. So the mouse actually is attracted to the smell of cat urine. It goes and seeks cats. It gets itself killed. It behaves in such a dangerous manner that the cat now eats the mouse. And then the life cycle of toxoplasma is completed. This is how this germ has evolved. The reason why I'm telling you this is because if one type of microbe is able to modulate the behavior in such a dangerous way, can you imagine what trillions of microbes are doing in our gut all the time? How much they are influencing our mood, our feelings, everything that we have. So if we have any detrimental microbes in our gut, they are going to change our feelings to something that we do not like, we do not want, because it is our second brain. The gut is our second brain. It is influencing our mood, our emotions all the time. It is communicating with our brain via the gut brain axis, via the vagus nerve. So it is called our second brain. And the way it does it is the gut microbiome, just like the other chemicals it is producing, also makes all of these wonderful neurotransmitters. Now, these neurotransmitters modulate our feelings. So what our feelings are, they are basically chemicals. When people fall in love, it's that oxytocin high that people have. Similarly, if we have dopamine made by the gut microbiome, so it is made in our brain and our gut. So in the gut, it is made by the gut microbiome. It gives us this feeling of being rewarded when we clean our house, when we complete any task, we have this feeling of satisfaction. So you might think that we are not feeling that satisfied nowadays because people have a dopamine deficit. We are burning it up by being on social media and digital devices too much. If you look at serotonin, which is our happiness hormone, 95% of our happiness hormone is made by the gut microbiome. If we do not have good quality gut microbiome, we do not have the happiness hormone. And what is important, you might think happiness and digestion is not related, but serotonin controls how fast food passes through our digestive tract. Serotonin is made during the day, and during the day it allows food to pass through the digestive tract at a very optimal rate, where food can be digested at a good rate, nutrients can be absorbed. That's what serotonin is required for, in addition to making us happy. In the evening, the same serotonin is converted to melatonin, which is our sleep hormone. So in the evening at sunset, we start feeling drowsy. That is when melatonin signals the gut, hey, stop passing food through the digestive tract. It starts slowing the passage of food in the digestive tract. And that's when food stops being digested. It becomes even more difficult for food to be digested. So people who do not have a good gut microbiome have a complete disruption of this system. In addition, people are also eating at the wrong time, way after sunset. So instead of digestion taking 2 to 3 hours, your body is being forced to digest it during sleep, when the body should be doing something else. And then there are other neurotransmitters also, like gamma aminobutyric acid, which not only play a role in our mood, but they are also required in digestion. So all of these are being impacted in IBS, and the microbiome test can tell you levels of these neurotransmitters. So when neurotransmitters are off, it's not just the feelings, it is also digestion that is completely impacted.
So there's a very interesting question from Ramnik Bhai, and I think this again is very relevant. So Ramnik Bhai is asking whether, he is noticing he's got iron deficiency for a very long time.
Yes.
And typically we say, oh, vegetarians don't absorb iron very well. But that shouldn't be true, because when you're young, you're absorbing exactly the iron that you need.
Yes.
So how does vegetarian diet or non-vegetarian diet affect this iron absorption?
So when we are talking about vegetarian and non-vegetarian, now vegetarians get the non-heme iron and the non-vegetarians get the heme iron. The kind of iron that we get is different in both diets. That does not mean vegetarians cannot absorb iron. I am also a vegetarian, by the way. The way we absorb iron is by having a good enough microbiome. That microbiome is going to help us absorb it in a way that our body requires. So for those of us who are iron deficient, I was iron deficient for a very long time and I did not understand as a kid. But obviously, when I fixed my gut health, that iron deficiency went away because I don't need to focus on absorbing. I have enough iron in my diet and I have the resources to be able to digest and absorb it. So that is the thing. It doesn't matter whether you are vegetarian, vegan, or whatever. Having
So,
the right microbiome is very helpful in that.
Rashmi, as a allopath, I'll tell you this is extremely interesting, because vitamin B12 and iron are two very, very common
Yes.
deficiencies. And I am absolutely stunned that if you could reverse your iron deficiency anemia merely by gut microbiome manipulation, have you had people who actually could reverse the vitamin B12 deficiency as well?
Me.
Okay.
And many more, of course. So as a child, I had taken B12 injections because I used to have mouth ulcers because of B12 deficiency. So I had to take B6 and B12 injections when I was a kid. Same iron deficiency, B12 deficiency, and anemia because of both of them. And as an adult, when I fixed gut health, my B12 levels are normal. I've never taken a supplement. My iron levels are normal, and I'm like, what really happened? So this is the
I've
case
got
for
two
every.
questions for you.
Yes.
First of all, it sounds like the real approach for anything gut related should be through microbiome manipulation, but it
Yes.
has to be a practical path. And the second part is I really want to know what is the role of processed food, because there's so much of talk against processed food, because it also leads to cancers. We
Yes.
know that your gut health decides your immunity.
Yes.
Immunity decides whether you're ever going to get cancer or not. So this all seem to be related with each other,
Yes.
right? So now, can you talk me through what is the practical way? Let's assume I've got a gut problem,
Yes.
or let's assume I'm absolutely feeling unwell, or for that matter, got deficiencies. What should be the correct route of approaching this? Is there a good test that allows us to check everything? How reliable is it?
Yes. If we want to measure the status of our gut health, the test to do is a comprehensive gut microbiome test. While the name sounds extremely fancy, it is just a stool test. It is as simple as doing any pathology stool test that most people do in their annual checkup. And the outcome of this is so much more that it's a 40 something page report where you see the kind of microbes that you have, the bacteria, the viruses, or whatever major types that you have, the ones that are completely missing. So there is something called a foundational microbiome. These are called probiotics. People know them only as supplements, but these probiotics are actually bacteria, yeast, and whatever microbes that are required in everybody to do the basic digestion, for basic training of the immunity, which immune system is also in the gut. So all of these to prevent all kinds of chronic diseases, because when our body gets what it wants, all the nutrients, there is no reason why it is going to create diseases. Because as a geneticist, I can tell you that most people are genetically normal. They do not have any such genetic defects or whatever. There's no family history of anything. There's a family history of poor lifestyle, most likely. And what happens in that, when we know what probiotic strains people are missing, they can take only those specific probiotics. Now there's a question here: how is the
Amol
VSL3?
wanted to know whether VSL3
Yes,
is
yes.
a good anti-probiotic.
So
Now, at the moment, you mentioned something very intriguing from a medical perspective. You said that we should only correct the deficiencies.
yes,
But to be honest with you, majority of our patients don't even know what is in their gut microflora.
yes,
Secondly, all we have available is two formulations, Simprove and VSL3.
yes.
So I more or less just give the same thing to everyone. Now, can you help me here as to how can we go about making it patient specific so it really works for them?
Okay, so if I say that, oh, gut microbiome testing is going to give you personalized medicine and all that, let me tell you, personalized medicine has been available since 1989. It is just that people don't know about it. The first, whatever, fecal microbiome transplant was done in 1989 for a patient who had Clostridium difficile infection. And it has been available ever since. If we talk about VSL3 or anything, any probiotic, I'm not going to say whether it's a good probiotic or a bad probiotic. It depends on what is missing in your gut. If you are taking something that is already present in your gut, you are only increasing the amount. It is not going to benefit you. It might even damage. It can be damaging. We have shown examples of that. That good bacteria, when they are in excess, like Prevotella copri, when Prevotella is too high, it causes inflammation.
That's very interesting, Rashmi. I always thought that you can have as many good guys as you want. You just don't want the bad guys. Now, that actually goes against the approach we are using, that is one size fits all. We are just giving them the same two
Yes,
probiotics.
yes,
Now, what you are essentially telling me is that we shouldn't go down that route and
yes,
we should actually do an assessment, find out the deficiencies, concoct the deficient bacteria
yes,
in an external culture,
yes,
and give it back to the patient.
yes.
Uh, Sounds really, really complicated. Can you just help me here?
So this sounds complicated, but it is actually very, very simplified. And if you think of, support groups and patients maintaining their diseases and doing this for their entire lifetime, instead of that, if they do this gut microbiome test, their report will be, I mean, it's a very simple thing, stool collection at home. The sample is shipped, it is analyzed. The report takes about 3 to 4 weeks. It's a comprehensive 40 something page report with the bacteria that are there, whether they are in excess, whether they are deficient, whether they are completely missing, and a list of probiotic strains that you need. It is as easy as, most people who need supplements just need to take one supplement, one pill a day for 60 days. That is all. And that is specific for their microbiome. And what
Yeah,
is
but
interesting
is
here?
it, yeah, there are two questions I have here. One
Yes,
is let's talk about FMT because it's a
yes,
big thing.
yes, yes,
And I can tell you today that ulcerative colitis now seems to be reversed with fecal microbiome,
yes,
microbiome
absolutely.
transfer,
Yes,
which is huge, I can tell you it's one of the biggest problems of gastroenterology. Obviously, people have this slight sense of yuckiness because we're talking about feces. So has anyone created a synthetic concoction that allow us to kind of instill as an enema, but effectively do the same job without the fibrous content of feces?
No. And I'll tell
Okay.
you why not. Because I'll come to the FMT part. But about this report, what I want to tell is that when people take this particular supplement, which is for them, these are the microbes that are missing. This is what they need to take. It is just one pill for two whatever months. And then they are also changing the environment. We are telling them exactly what dietary recommendations to follow, because the microbes are not going to live unless we are going to feed them the right kind of food. They are not going to thrive in the environment that people have created when they have any disease. That environment also needs to be changed. So that is what the report encompasses. It gives a detailed phase wise this thing, that in phase 1 you need a gut detox where we reset the gut. The phase 2 has this thing, recommendations of the foods and probiotics they need to introduce, the foods they need to use to feed those bacteria. And in phase 3, it is again to enrich that. So when we talk about FMT, it is for extreme cases where people have very serious disease that needs urgent attention.
But you took the other question from my mouth, which was diet. Now, instead of actually taking a pill, can I just use diet to manipulate my gut flora?
It really depends on, so when people come to us, we analyze what exactly their conditions are. If it is very straightforward, we tell them that okay, this can be fixed with diet. But for IBS, what we have noticed, and there's a lot of research out there, the publications that have in very reputed journals, that for IBS there are very specific strains that are missing. Some people even have pathogens. Like one patient who came to us, she was suffering for 20 years from IBS. When we did the microbiome test, she had a specific infection which no diet would have ever detected. She had this Giardia intestinalis which needed medication. She had to take medication for that.
Absolutely. I get that. Let me answer Vishal's question. Probiotics surviving gastric pH because gas stomach is acid. So Vishal, this was actually tested out at UCH about 6 years ago when we put all the commercially available probiotics to check what percentage survived the gastric transit. And that is where we realized that only VSL3 strokes improve because they're exactly the same. They were the only ones which actually had some demonstrable flora passing through the stomach and reaching the intestine. Now, having said that, actually, it is not about having the whole volume. If you can get the right strain in, it should grow there. So, probiotic therapy is never alone. If you're just taking Simpro without changing your diet, it's not going to work. And that is why it is very, very important that you have a dietitian in tow who understands how you need to ensure that and then start taking probiotics. But the question is really good. This was a genuine question in our minds as well, that you're putting bacteria and you're going to all get killed in the stomach. So how do you take it to the gut? So people have also started talking about whether we can create, medical enemas with all the missing species. But at the moment, enemas are not that well accepted as treatment method for most of the people. People don't accept. They are much happy to take a pill. So keeping that in mind, BSL3 and Simprove both have definitely bacteria that reach your gut. But Rashmi, you'll probably concur with me here that only putting a probiotic is not enough.
No, no, no. People have done that. You will see that whoever comes to us, they say that, oh, we are taking probiotics. It will, whatever, resolve our issue. It doesn't get resolved because not only they not know which probiotics they need, they are taking something non-specific. The other thing is they are not fixing the environment. And they think that they can keep taking these probiotics their entire life. Why do they need to take it? These bacteria should establish in the gut. We have to create an environment that is conducive. We have to feed them the right kind of foods. And FMT is for cases where, there are extreme cases, like in autism. They need serious help, timely help, and it is a quite severe condition. And it is multifactorial. But FMT, again, FMT introduces not just this subset of probiotics, it is introducing everything that we don't know. There's a lot that we don't know in this field yet.
Yeah. So
So
there's one interesting digression I want to speak to you. It's not IBS, but you get exactly IBS-like symptoms
yes,
in cancer patients who are undergoing chemotherapy.
yes.
And we also know the immunity is very suppressed. In fact, we are actively trying to kill the multiplying cells. Is
Yes.
there any role, especially when you finished your chemotherapy, to go for probiotics?
So cancer itself, so we talked about this last time for why people have cancer. Everybody has cancer cells in their body. It's only when your immune system is trained well enough that it can detect these cancer cells, it will kill cancer cells on time and prevent cancer from manifesting. But a lot of people do not have that kind of immunity. That's why we have these huge rise in cancer cases. So when people go for chemotherapy, again, the microbiome plays a role at every single step. How people respond to chemotherapy depends on their microbiome. You will see a subset of responders, you will see another subset of non-responders for the same kind of cancer, for the same kind of treatment. They have a very different microbiome. That's why they react differently to the same treatment. If they change their microbiome, this has been done where there are many scientific studies where they have done a fecal microbiome transplant from responders to non-responders, and then these non-responders start responding to chemotherapy
Wow.
because their microbiome is manipulated. And then even after chemotherapy, that chemotherapy is damaging the microbiome. It is damaging, so they
Rashmi,
are
you're
going to see
opening
these
up a
effects.
huge area, and I'm going to interrupt you here because I've spent 2 years studying cancers at
Yes,
ICR.
yes,
And we all talked about gene expression being one area where our understanding is really poor.
yes,
What you've just mentioned to me seems to be that the control of your genomic expression, i.e., proteomics, is directly influenced by your gut microbiome.
yes.
Is that too big a statement to make? Because whilst others
No,
might
no,
not
no,
understand, I can tell
absolutely.
you that this is the one lock. That is the lock of health.
Yes,
And if you're saying that, listen, your genomic responses can also be altered based on what gut bacteria are telling or doing, then I think it is very, very valuable for us to ensure that people are aware. I think the awareness is the biggest hurdle at the moment because if you ask me, on an average day, 20,000 people are having chemotherapy in England alone.
yes,
And if these people, only about 50 to 60% will respond. Chemotherapy does not have a high response rate,
yes.
contrary to popular belief. Are we saying that we are missing a very small 100-pound test and wasting millions of
Yes,
dollars?
yes, we are. So I want to give one example here. What
Wow.
you just said about genetics and proteomics, I want to add a layer in between, which is epigenetics. So most people are genetically normal. Most people are genetically normal. They don't have any such cancer genes or any genes to cause diabetes or whatever. But what is happening here is that, for example, if I have a recipe book, so my DNA is a recipe book that I have received from my parents. My cells are using the recipe book that I have received from my parents. But what is happening here is based on the previous 3 generations, what they have consumed, what their lifestyle was, their recipe book, what they have done is they have stapled some pages because of starvation, because of a poor lifestyle. Some of the recipes that I have received are stapled. That means they are chemically changed. I don't have the DNA mutations, but they are chemically stapled so that I'm not able to access those recipes. They are there in my DNA, but I cannot access it. Some of them, which were supposed to be stapled, are opened because of a poor
Wow.
lifestyle. So now, whatever was supposed to be hidden is open. Whatever was supposed to be accessible is stapled. So my DNA is still the same. But whatever has happened inside, the chemical changes that I've received from the previous 3 generations because of because they were starving from whatever pre-independence, because whatever happened, that lifestyle issue is still there epigenetically, and because of a poor microbiome that they had. Those are the combinations. The microbiome is causing all of these epigenetic changes. So unless we change our lifestyle to a very healthy one, our diet to a very healthy one, we are going to hand this stapled book and whatever the changes to our children. So we are going to suffer, our children are going to suffer, and poor DNA is going to get blamed. The DNA is normal. It's not nothing to do with.
Wow, I'll tell you, you're literally blowing my mind. And I think we should have a separate session just to talk about cancers, family history, and microbiome. I think it's a massive area.
Yes.
Vishal, you're right in saying obesity has been linked to epigenetic changes because
Yes.
populations which were starved in the previous generations, they are the ones who are much more likely to become obese once a lot of food becomes available. And that is why Mediterranean population is not getting obese despite consuming more calories, right? And so let me come back to the more
Yes. Yes.
practical thing because I think we have another 10 minutes before
Hmm.
Renu will let everyone else participate.
Yes.
So tell me practically, how do I go about getting myself sorted out? Let's assume I want to be 21 again. I want to
Yes.
feel like a young, energetic man. What would you say if I've got IBS symptoms? How would you say is the practical way? I know there is a fecal microbiome test, but I just want to know the practicality. Is it available on the NHS? Has it got to be done privately? Are there any do's and don'ts? And I am sure Renu here is nodding because she's been an expert in that area. I'm well aware of that. So between the both of you, can you give me the practical steps and if possible a contact number for anyone? Put it on the screen so if
Yes.
anyone wants to approach, they have access.
Yes, so Renuka will do that. She will give the contact number for UK. This test is it's a private test because it's a private test. The reason being is that whatever we are seeing that is available in the medical system is, as you know, is for maintenance of IBS or any of the other diseases. It is not for resolving. And this is not a new test. It has been around for several years. There are several thousands of people cured from their IBS and other diseases. So Renuka is going to post all of the information related to that, how people can get tested. But it's a very easy test where you get the kit in the comfort of your home. You post it or whatever, or it can be collected, and the report is just online. We have a consultation also included in that where we explain the entire report. So for people who have IBS or any other digestive disorder, it is as simple as ordering the test from our website, getting the kit. It is a simple collection of stool sample. The instructions are given, very clear instructions. There's a booklet in the kit included, and it needs to be sent back to us. Again, everything is included, all of the information is included. Then when they get the report, there are action items that we explain. It is as simple as that. You will get a personalized dietary recommendation. It also gives, this is another interesting thing included in the report. They will get the whether their neurotransmitter levels are ideal or not, whether their vitamin levels are ideal or not, what kind of disease risks they have based on the microbiome, so that they can take action before they start seeing the other diseases like leaky gut, like diabetes, like arthritis, anxiety, depression, and all of those. And there is also antibiotic resistance. So we find that 90% of people who come to us have resistance to some antibiotics that probably they have never taken. That is the strangest thing. It is coming from the food, the environment, from somewhere outside, not from the antibiotics they have taken. And they should know about it.
So Rashmi, can you reverse diseases
Yes,
by
it is
changing your
possible.
microbiome?
Yes, absolutely. It is possible to reverse diseases. We have reversed diseases using the power of the microbiome. And, we are talking about IBS right now, but we had amazing transformations even with people who were recommended, like people who had hip necrosis. Somebody came to us with hip necrosis. He was recommended surgery. We were able to completely avoid it in 3 months.
Wow. No, again, like I said, I'm extremely impressed with the information I'm getting. And I used to think I understand the microbiome a bit. So I think it is really, really important for us to stress two things.
Yes,
One is that we need to create a lot more awareness around this topic of human microbiome because it seems to be linked to complete health, not just one aspect. IBS is just a small area.
yes,
But Rashmi, I also would say that probably a session on cancer and human microbiome would be extremely welcome. I can clearly see because when you start talking about epigenetic changes and generational shifts, there's so much in cancer that we know happens, but we
yes,
just never knew why it happened and how you can control it.
yes,
This is really, really important. I think it is important that we have that session. I'll be very keen to ask you a lot more questions. But at this point, I would let you do the concluding
Yes, yes.
before we let everyone else also jump in?
Yes, I just want to add two things. You just said that, you talked about IBS, but before that you said you want to feel like you are 21. A lot of what we see in aging is very much dependent on the quality of our gut microbiome. And when we reverse that, when we make that a very healthy microbiome, a very diverse microbiome, people actually start seeing differences in their rate of aging, how young they look. There was a very interesting experiment done a few years ago where the fecal microbiome transplant was done from very young mice to old mice. So interestingly, the old mice started showing parameters of youth. Their
Wow.
aging was reversed just by a fecal microbiome transplant.
Again, like I said,
That's
I
how
can only
powerful it
say
is.
that awareness is just unbelievably important.
Yes.
So,
And this cancer thing, of course, we will do that because there are so many different layers in cancer that we can talk about in terms of the
no,
microbiome.
like I said, there I would keep my role as a GI person out, and I'll go back into my research mode, simply because that was something I've spent a significant part of my life on. So let's have that session. But
Yes.
Renu, if you want to just summarize everything and open the floor and
Yes.
make it a bit more interactive, I think that will be very helpful.
Yeah, definitely. It's a very informative session, Abhay and Rashmi, as always. This information is definitely missing when we can see the social media is full up of so many other kind of videos. But definitely, guys, like everyone who has any question, please, you can unmute yourself and ask the questions. We are open for the everyone. They can ask any questions here. It's a good
Uh,
chance to you can get
yeah,
answers
let me
from both the
start
expert.
first. As an audience, let me ask you, Rashmi, obesity, is microbiome testing and reversal really useful?
Absolutely. For obesity, for weight gain, that means the microbiome is extracting nutrients in a way it should not. It is extracting too many calories from the same nutrition. So, I think I mentioned it before, even in pregnancy, we see that in the third trimester of pregnancy, the microbiome changes to extract more nutrition from the same food, more calories from the same food to help the baby grow. So in obese people, there are many experiments that have shown that people who are obese versus people who are lean have a very different microbiome. So the microbiome is extracting calories in a very different way that leads to the weight gain. So if people are able to identify what are the problems in their microbiome, they can go back to having a normal weight after fixing the microbiome.
Perfect. Uh,
Yeah,
Rashmi, sorry, Renu, there's a question on cost, and then we'll allow everyone to,
yeah. I
have a
think
say.
Ramnik ji want to ask something.
Actually, it is about the procedure. I'm not quite sure if I wanted to have a consultation and then get the test done and then find out whether there's anything can be done, what the exact procedure is, and of course, the question of cost as well. Who do I
Renu,
do? I just ring this number 073 and take it from there?
So basically, Ramnik ji, I have shared the WhatsApp
Yeah.
group link here. You can join our WhatsApp group. If you want first consultation, you want to talk to Dr. Rashmi, she can connect with you for that. And once you had a conversation, and then if she thinks that the microbiome test is really useful for you, then you can buy the test from our website. And then once the result comes out, then you can also again having the consultation with Dr. Rashmi, and she can explain the whole output, what is the result of that test and how you can proceed with that, what kind of changes, lifestyle changes you have to make it. So all these things is going in that way basically.
Sorry, what do you mean by when say buy the test from the website? I mean, will Dr. Rashmi will tell me which test to buy?
So basically, yeah, definitely she can tell you which test you can buy as well, and she can help you not we don't recommend everyone to do the testing, but if you have that kind of symptoms or anything, she will definitely recommend you in that way. And once you get that result, then you can buy the test from the our website. We can reach out to you, we can help you to buy the test as well. And the test will come with the pre-booked like a courier as well. Like once you done your sample, you will get back the courier with us, and then we can test it and we can give you the result basically.
Yeah,
So,
so
Renu,
I
let
think
me
that
just
the question is
clarify
that
for Aminji. So the
the,
process is you join the WhatsApp group.
Yes.
I am already there, but I didn't still. I had looked up a couple of a month ago something, but I still didn't understand the full procedure. Question is, talk to Dr. Rashmi. She will probably prescribe the test and then get the test done, and then talk to her again. So,
Yeah.
what is the total cost of a one set of procedure like that?
So right now the cost is 300 pound, but because you are attending this webinar, so we are giving some discount to you, and it is 275 pound for the one test.
Right. Thank you. Okay, that's all right. Okay, because and then if you wanted to, there's a possibility because I might be covered privately. Does it work at all in this sense or not? No.
Afraid actually right now it
Yeah, I
is
think
not.
I was told last time it doesn't
Yeah,
work.
it is not covered right now with uh, the any insurance agency, but like we are trying to work in that as well
Okay, thank
because
you.
yeah.
Are there any other questions? Vishal, Amol, Vardhini? I think there are no more questions. So, Renu,
Okay.
and on that note, Rashmi, I really am looking forward to a conversation on cancer.
Yes.
Renu, it will be helpful if I get the links a little earlier because a lot
Yeah,
of my groups
definitely.
actually are very, very keen
Yeah.
to listen to this.
Yeah.
And let's make awareness one of the agenda items. I can clearly see that, you know, awareness is so seriously lacking right now.
Yes.
And this I'm telling you as a doctor. If a doctor doesn't know, then what is the chance that a patient will know?
I really want to talk here, Abhay. We are doing these webinars, like every month, 2, 3 webinars with different location, and people thinks that we are doing marketing. It's not about marketing. It's about we have started one initiative to help the people because this knowledge is completely hide from many years, right?
You know, even if
And
it's marketing, I don't care. I'll tell you, it's a good thing. So if someone markets me good health, I'll say all for it. Come and tell me how I can get. I wouldn't worry about what people say. What we have to do is ensure that we spread the message. What I would
yes,
request is any one of you, if you feel that it's your group or your community that will
yes.
benefit, I'm sure if we can bother Rashmi and Renu, they won't say no.
Yeah, definitely. We
Anytime.
are happy to do the like a in-person event in London as well. If we get like a good kind of people who really interested in this thing, we definitely do that as well. We are for that.
Perfect.
Yes.
Thank you, Rashmi. As I said, every time you're like a box that never ceases to surprise.
Thank
Okay. And epigenetics to me is an area that is absolutely huge because it decides so much in your life. You know, whether you're going to get a disease, whether you're going to, right from how you're going to look, everything is decided by epigenetics. So I would love to have a conversation on epigenetics, cancer, and microbiome with you. And Renu, thank you for organizing this. And thank you everyone for participating.
you so much.
Thank you so much. Thanks everyone.
Thank
Thank
you.
you. Bye.
Bye. Bye.